Welcome back, everyone. You're watching We Heart Therapy. I'm Dr. Bell, licensed marriage and family therapist and certified EFT supervisor and therapist here in fabulous Las Vegas, Nevada. And I am extremely excited because today we get to welcome on this most famous and wonderful genius mind that I had the privilege of meeting in Amsterdam last year at the Summit for Emotionally Focused Therapy, which is my specialty. And this is Dr. Emily Nagoski. You guys may recognize her as the author of Come As You Are. She's also written a book about burnout. So many of you are familiar with her work on sex and sexuality for women and for couples. She's also written a tremendous book on burnout. And I'm going to link that in the description for the video. And one of her newest books, Come Together. This book is freaking amazing, guys. If you have not bought it, you need to. I have it all tabbed up with my notes because there's just so many gems of wisdom in here. And so we're super excited. Emily's going to be here with us today talking about playfulness. Thank you, Emily, so much for being here.
It is absolutely my delight.
So, playfulness. Okay. And first off, before we dive in, is there anything that you want to say? Anything important, like what's going on in your life, or where do you sort of find yourself these days?
The most important thing is, for me, the audiobook.
Mm-hmm.
So the only thing I ever ask for in any of my book contracts, and this has been true for more than a decade, is that I narrate my own audiobooks. It really matters to me that somebody who has spent their career like not feeling uncomfortable talking about sex, narrate the audiobook. And this year, Come Together's audiobook got nominated for an Audie Award, which is sort of like the Oscars of the audiobook world. It's not going to win. Common is also nominated in the same category, and Common's going to win, and that's fine. I'm happy about that. But just like being truly, like having a sex book of any kind being nominated, it almost never happens. And I'm very, very, very excited about that. So if anybody there is an audiobook person, I really recommend the audiobook version of Come Together.
Absolutely. And I will also link that in the description for this video because having Emily, you know what, I agree. Having the original author narrate the book really just changes it. And
it makes so much of a difference.
Yeah. And from personal experience, when I heard you give the keynote at our EFT Summit in Haarlem, Netherlands, which is a suburb of Amsterdam, I mean, you're fantastic. And the inflection in your voice, I could hear you talk about the alphabet and I would be enamored.
You know what that comes from teaching college students? 80% of college students are dangerously sleep deprived.
Yes.
So they trained me to be walking, talking caffeine. They made me like this.
And you know, when I think of like college courses, I don't think of someone awesome like Emily Nagoski teaching a course. I think of like, sorry to be maybe sound stereotypical, but some old white dude like droning on,
real,
who's boring as heck and really doesn't know how to engage. Now I know there's plenty of professors on all the way across the board of all genders that are fascinating. I just haven't had the pleasure of being in many of their classes. So I did have one professor, though I will say I have an ADHD brain, and Emily, I appreciate that you also are neurodivergent, and my brain takes notes with colored pens. I color code them, and so I have this funny little bag of pens that I brought to my assessment course in my master's class. Got my master's in clinical mental health counseling. My professor was from Argentina. He was actually pretty funny, but he called my little bag of pens very neurotic. So I was like, thank you, but you don't understand my brain. So thanks for...
A clinical professor?
Yes. Thanks for judging, dude.
Yeah. Thanks for like an actual diagnostic label on the learning tool that helps me to learn the information you're trying to teach me.
Exactly. Well, exactly. Assessment class. It's all about diagnostics. So
oh my gosh.
Sure that's all he did outside of teaching was diagnostics and not actual therapy. So
yeah. Part of me is like, I bet he was autistic.
Maybe. Yeah.
Cause like we're good at diagnosis. Like we're good at categorization. Do you meet the criteria?
Mm-hmm. And yet people just aren't their symptoms, right?
People are not their symptoms. And everyone within a diagnostic category still varies tremendously from everyone you've ever met, even among all the people who fit within that same diagnostic category.
Yes, yes, I'm so with you. And yes, there can be times where diagnostic labels can be helpful. I personally, in what I do and the kind of therapy I do, found them very unhelpful. And they just tend to box people in, have them feel really judged or shamed. But also, it doesn't tell the whole story, right?
Mm-hmm.
The symptoms paint a story about somebody's real experiences. And when you really dive into their experiences, then these symptoms make sense. It's like, well, yeah, if I had that experience, exactly, yes. So it's not what's wrong with you, it's actually what's right with you, given the context of your life.
For me, a diagnosis has been like a place to start in understanding how to live with my brain.
Mm-hmm. Yeah. And ironically, the original DSM, the medical model, we diagnose people as sick so we could treat them with medication. But there's so many diagnoses in there that we're not going to treat with medication. So why are we still leaning on that when we're not going to be treating with medication, in certain kinds of therapy? So, yeah. So, and then rolling that over. So let's talk about playfulness. And so you've done tons of research, and all of your books, I love, talk about neuroscience and emotions. And I definitely think if people feel judged or kind of labeled, it's going to be hard for them to be in a brain state to experience play.
Totally.
But can you sort of talk about, well, okay, first let me give a slight bit of background about why playfulness. So I, as a therapist, lead a lot of ambitions, a lot of dreams and aspirations. I have the private practice. I run a nonprofit. I help train other therapists, write books myself, podcasts, all the things, right? All the things they say you need to do. And I would feel this, I noticed over time tuning in, this heaviness in my nervous system. And I think I sort of started to feel like kind of chronically pissed off, but I wasn't really an angry, negative person. I'm always happy and bubbly. And it dawned on me that chronic seriousness can weigh on your nervous system the same as chronic negativity. And I realized my nervous system wasn't shifting out of work mode and serious mode. Just because I left the office, I was still answering emails. And when you work for yourself, you're your secretary, your biller, and the clinician, the marketer, like one man band. And it's hard. So you're always working. And even when you're not working, Vegas is kind of a small town. I'd always be afraid, oh no, I might run into a client in public. So I'm wearing my work clothes, which makes me feel like I'm at work because I'm afraid to be seen. And then, that also played a weird part in feeling like I'm always at work. And so my nervous system isn't shifting.
Mm-hmm.
And so I began to contemplate this idea of playfulness. And I have retreats for therapists on this now. And so I want to have you, Emily, talk about maybe like the brain mechanics of playfulness and its role in burnout and sex and all these things.
Yeah. So I stumbled on play as a necessary aspect of human life because I was looking at the affective neuroscience of. So I'm a sex educator, and my first book, Come As You Are. Look, you might think that writing a book about sex where you're thinking about sex and talking about sex and just sex all the time, you might think that's super, very sexy. And it turns out, no, it's just like very stressful and exhausting. And so while I'm writing about sex every day, I lost all interest in actually having any sex. And because I am a big nerd, in order to fix my problem, I went and read a whole bunch of affective neuroscience. And I ended up using the model established by Jaak Panksepp, who recently died, actually. Alas, so many of our great leaders in the past few years, including the glorious Sue Johnson, we have lost. And his model of the 7 primary process emotions. So these are the core mammalian emotions. And when I say mammalian, I mean all mammals. So these are the emotional systems of your dog and your cat and every human being in your life. These are universal mammalian experiences, and they are all necessary. The reason this is the model I chose, we live in a world where there are multiple competing models for how human emotions even work, and only one of those models includes sex.
Mm-hmm.
So that's the model that I chose. And what I learned is there's this emotional motivational system that Jock Panksepp called play. And it is the motivational system of friendship. Whether you are a dog or a cat or a mammal, you have this system in your brain that motivates you to engage with other mammals, or especially other members of your species, but anybody who has played with a dog knows that it's cross species, where the characteristics of play, you're engaged in behavior for its own sake, for no purpose beyond this activity, where nobody has anything to lose and there is no other goal. And nobody means anybody any harm. So when you're, I don't know if you're a dog person. I'm a dog person.
I'm an animal person, period. Grew up with dogs, cats, horses. I currently have 2 cats that...
Horses. Horses, absolutely. Like anyone who spent time around horses, you know horses have a play system where they get into a state where they're feeling really playful.
Yes.
They do have like a work focus mode where they're like, I am doing my job right now. Just like a dog has like, I am doing my job right now. And they also have a play state where they're like, there's nothing at stake. We're all just, I mean you no harm. Let's engage in this fun behavior. So when your dog goes down on her elbows and the ears are soft and up and the mouth is soft and smiling and the eyes are bright, that's a play bow. It's an invitation that says, anything I do after this, I mean you no harm, and let's just play a game where nobody has anything to lose and we're just doing it for the fun of it. And the function of the system, the reason it's so important is that this is the primary way that mammals build social bonds. We usually think of building social bonds as being this like very tender, like I'm holding an infant or I'm holding my beloved partner, and it's very peaceful and sometimes even like very serious. But and that's true. The care mechanism in our brain is very powerful.
Yeah.
But play is also really important. And man, when humans grow up, we kind of recognize that play is valuable for children. We kind of recognize that. And yet we overschedule our children. But man, once you get to be a grown-up, the world starts telling you that play is a waste of time, that play is frivolous, when play is biologically necessary. And for me anyway, and for an amazing proportion of the people that I talk to about this, play is the state where it is easiest to get into the sexy state of mind.
Yes. The play door.
Yeah. Like it just like there's like a water slide in your brain. You get into a play state with your sexy someone special and like you're like tickling each other and laughing and giggling and it just like water slides down into the lust space. Yeah.
And you know what's so interesting? And you talk about like when we become adults and we decide that, play is no longer necessary. And, it just made me think about how we also do that with emotions and needing comfort. It's like you're an adult now. Emotions are just for little kids, and needing care and comfort is also just for little kids. And you just do all that on your own. Keep it down. and people are more depressed, more anxious, more suicidal, more alone than ever, despite all the neuroscience saying, hey, it's actually not a good idea.
Connection is super essential. Jonathan Haidt, a long time ago, described humans as 90% chimp, 10% bee. We might as well be a hive species. A single human is not a complete life. Like, we require connection with other people. Even I am autistic and an introvert. And even I am like, sometimes though, I need connection with another person. It doesn't come naturally to me, and too much of it can be very overwhelming, but even I need some. And if even I need some, everyone listening to this needs connection with other people in order to be complete. And some of that is going to be, I'm very sad and alone. Could you please lie with me in this bed and we'll hold each other? And some of that is going to be like, let's play Boggle.
And I love games. I'm the one at family parties, like, all right, everybody, let's play a game.
Game time.
Yes, it's my favorite. And, it's so funny. So you talked about, my little squirrel just leapt off the wheel again. It got so excited. It's like, woo, this is fun. We're going to play. So trying to backtrack. I feel so embarrassed when that little hamster just runs
nowhere. Again, my husband is ADHD, so I'm very, very comfortable with like the squirrel jumped off the wheel and went over in that direction, and like, what do we do to coax the squirrel back to the place so we can remember what the next thing was? Very comfortable with that.
Yeah, so we're talking about connection, the necessity of connection. I love what you said about the hive, and it feels like so much of society now is like in some way trying to cut us off from the hive and saying it's wrong, like it's pathologizing the human survival, the fundamental survival need and benefit to our like quality
that it's
of life.
Like selfish to need something from other human beings, and like, how dare you impose your emotional needs on another person?
You're weak and not able to stand on your own.
Right, that you're not strong enough, you're not independent enough to be able to meet an emotional need that human beings evolved to help each other meet that need.
Yeah. So it's like we're kind of pathologizing attachment, and we're masking independence. We're masking, really, it's avoidance, and we're calling it independence. Yeah. And they're really different.
Like, adulthood means isolating yourself completely and entirely. And it's so toxic. And I'm sure we'll talk about like the gender part of it. But like, if you get raised as a girl, at least a part of you, and it's a pathologized part of you, that is like, because you're a girl, you're going to need to have your emotions acknowledged by another person. But if you're a man, you are not allowed to have any needs from another person other than sex. If you experience yourself having a need for connection with another person, that's horny. All of that is horny. You're not lonely. You're not longing for play and connection and care. You're horny. And it just dismisses all of the whole range of other human emotional experiences. And it tells women that they are inferior because they have those normal human longings for connection.
And it also kind of calls something important to me that I feel really kind of sad about, and it's our poor guys, is that we know that they have a natural emotional system, and I feel like they're getting tons of mixed signals like, shut it down, be strong, don't be emotional, you're not allowed to express emotion. But then we're like, I want you to be soft and sensitive. And for a long time, it was like the only...
But don't be a pussy.
Right. Yes.
But be soft and sensitive. Yeah.
Yes, exactly. So mixed signals, but then also it's like the only place we've made it safe or socially acceptable for them to seek care and be vulnerable, let their guard down, is in sex. So then guess what?
As long as they have an erection,
yes,
they're allowed to want and need connection.
Yes. And so now all the pressure goes into the sex basket to get that need met. And then we judge men for wanting sex all the time. And we're like,
Right.
but we haven't given them any other healthy options to these needs met. We've
literally punished them their whole life for wanting and needing any other kind of emotional care.
It's almost like that book Utopia. First we create criminals and then punish them.
Yeah, exactly.
I'm not saying men are criminals. I'm just saying it's the same, We have
men are horn dogs.
Right.
And then we punish them.
Exactly. So
men are invulnerable emotionally.
Yes.
And then we punish them for it.
Yes.
Yeah.
Yes.
I get why men are confused and have like everybody is screwed over by this system. Like there's a package of mammalian emotions. All of us have all of them. But if you get raised in it's a girl gender, you're like, no, you get this subset of your emotions and not those other ones. It's like living in an apartment. It's a 4-bedroom apartment with 2 bathrooms, but 2 of those bedrooms and 1 of those bathrooms, nope. You don't have access to any of that. And if you get raised as it's a boy, 2 other of the bedrooms and 1 of the bathrooms is available, but not those other ones.
And it's crazy. Okay, so back, I think it was like the Victorian age, doctors used to basically jack off women to treat hysteria.
So that turns out actually to be false. There's a book about it called Hysteria. Yeah.
Thank you.
It turns out that's not true. Yeah.
That's okay. Good to know. So not true. But women have been, like you said, with those emotions. If you have too much, like if you have too much anxiety or too much anger, you can be hysterical.
Yeah. Hysteria means wandering womb. Doctors did literally believe that the uterus was just sort of like floating around in a woman's torso. And we need to the reason you get a hysterectomy is because your wandering uterus needed to be removed to stop it from where's it go? Like, what did people think was happening? That it was squishing itself up against the intestines and the stomach and the what were people imagining was happening? And how was it causing women to feel exhausted and overwhelmed? What?
All the crazy things they used to say before they actually had science to take a look at what's actually happening and come up with real explanations.
Yeah.
So how do emotions play into playfulness? And let's talk about specifically what kinds of things inhibit the playfulness state.
Yeah. So there are, so as I was reading this research, my job is to translate hardcore science into something people can actually use in their lives. So as I was reading this science, I was like, so let's think about this as an emotional floor plan. One of the reasons I talk about apartments is because there are certain rooms, there's a space you can get into in your brain that is the play space and the lust space. And there's a seeking space and there's a care space. These are the 4, I call them the pleasure favorable spaces. These are the spaces where your brain is capable of interpreting a sensation as, oh, I like that. Oh, that feels good. When you're feeling cared for, when you're motivated to care for someone else, when you're feeling trusting and connected. I'm sure as an EFT therapist, you talk about trust all the time. You know how important it is. And boy, is it a facilitator for that care space to get you into that. I feel good. I feel connected. When my partner touches me, it feels good to me, because it is activating my sense of safety. I feel safe enough in this relationship. I feel cared for and I trust this person. Mm-hmm. Play is like that too. You have to feel safe enough. If you're in the middle of an argument and you start playing a game, that argument carries over into the game. It's not actually fun. You start enacting the argument within the game. And the point of play is there's supposed to be nothing at stake.
Right. And I think that's, it shows up with a lot of my couples where one partner will use humor to sort of avoid that emotional intensity or to like lighten the load. And for the other partner, it's like, no, this is
That
serious.
feels dismissive.
Yeah.
Yeah. Yeah. And I've been there. Like my partner's a cartoonist. He writes jokes for a living. And early in our relationship, I was like, that's disrespectful for you to make a joke. And we did an EFT weekend workshop. And that was where I learned, oh, you're just trying to diffuse the tension. That's an invitation for us to stay connected even as the argument escalates. It's a way to like de-escalate and keep us connected. It is not trying to dismiss the argument. So if you can understand where the humor is coming from, there is such a thing as mean-spirited humor. And not everybody is coming from a place of like play and connection when they're making a joke. Sometimes, some people are belittling their partner. So knowing that intention and knowing how to interpret it. And they'll say like, oh, it's just a joke. Can't you take a joke? And that's sort of how you can tell what their intention is can't you take it?
Yeah.
Because if you're like, I just told you that I can't. Like their response should be, I'm so sorry that hurt. I intended it for it to be playful and for us to stay connected. And what you're telling me is that it had the opposite effect. And I'm sorry that it had that impact, right? Like you want to hear that your partner heard that the humor didn't help. And then hopefully, if that is part of how your partner communicates, like mine, man, I can't even tell you how good it was for me as a human being to learn from my partner how to get better at staying in a play space in my mind.
I love that you're saying that because ironically, joking and playing is something I'm trying to work on that might sound weird as a therapist.
No, I so get that.
Like, how do you work on that? I actually had a very imaginative childhood, a lot of creativity, extremely, extremely imaginative. But as an adult, comedy can be hard for me. I love to laugh and I do enjoy comedy. The problem is also part of the way my ADHD brain thinks and part of how I was raised is sometimes my brain takes things so literally. And as a kid, when we were going to have jokes or laugh, we were really primed for it. So it was like, I'm going to tell a joke now, or would you like to hear a joke? So you knew, okay, insert laughter here.
Right. Yeah.
Or we're going to watch a funny movie. So you knew, okay, my brain is primed to laugh.
You get into the space and then you can do the laughing, but the laughing doesn't draw you into the space.
Yes. Yeah. Now it doesn't like automatically occur to me when someone's telling a joke. I don't always, but also I grew up with two big brothers who had very dry and sarcastic senses of humor. So if I do tell a joke, it tends to be very inappropriately timed, a little more of shock value, like, and that doesn't always bode well. So I'm trying to work on comedy and laughter because I do enjoy it. And it is.
Yeah.
And there's a difference between, I think you talked about it in your podcast with Brene Brown on Burnout, sort of like the difference between almost like a fake laughter versus authentically.
Oh, yeah. There's that like socially appropriate, my boss cracked a joke. So you go, yeah, this is me acknowledging that you tried. Because like that's my job and my paycheck depends on you feeling like I got that you made a joke.
Or even if divergent brain, like I laughed to make it look like I understood whatever.
Like I understand what's happening right now. Everyone else is laughing, so I'm gonna laugh, and people are gonna feel like I am part of the group. Did I get away with it this time? Do people believe that I too am a human being? Yeah. Versus the like belly laugh, the helpless, crying, stomachache kind of laughter where you cannot help yourself. It is powerful stress relief. It is hugely bonding, this sense of social connection in joint laughter about something. One of those stories I tell is being at a conference with a bunch of, like, it's a small conference. I know these people really well. I work with them all the time. And, you know, Friday night at the conference, we're in someone's hotel room drinking. And one of my colleagues starts telling a story about taking her two young daughters to the pumpkin patch, right? So it's Halloween. It's supposed to be this delightful, fun thing, but they're running really late and she's really angry when they get there. And like the kids are being whiny and complaining about like which pumpkins are available. And like, as a mom, she's feeling like she is failing at Halloween. And she gets mad and yells at her kids in the pumpkin patch. And as she's telling the story, she has like an appropriate sense of perspective. And we are all laughing hysterically. Like, we cannot stop laughing at how funny it is that she's holding herself to this standard that she's like this terrible failure. But her kids are also terrible kids because pumpkin picking is not working out the way it's supposed to. That's like, it's not the kind of story where like, if I tell it, you're like, that's so funny. It's actually like,
But
in the moment, it was incredibly painful.
And also it kind of takes, like, you're painting a scene about something that could be fun, and how when we take it really seriously, it can take
Right.
fun out of a fun situation.
Exactly. And in retrospect, like 2 weeks later, she could absolutely laugh about, like, I was taking this so seriously. I did not know how to have a good time at this thing that was supposed to be like making memories with children, right? And like,
So you're talking about letting your guard down, like being able to let your guard down in order to laugh.
yeah,
Guard, like if your brain is in sort of the threat zone, right, where the amygdala is on laugh.
yeah.
And you
She
said,
had an expectation for herself, right?
yeah,
And she was falling short of that expectation and
yeah,
judging herself and kind of taking that out on her kids.
yes. This goes back to what you said a moment ago, the nothing to lose principle.
Yeah.
And so what is it? And I see this with therapists too, where I try to help them learn how to play to help shift their nervous system. And a
Mhm.
lot of them just won't, it's like they just won't let go. We're too afraid. And I've been in this space too, of looking like an idiot in front of our colleagues. So our brain is in threat zone, which is the enemy of playfulness
Yes.
and pleasure. And playfulness, I love, it's in the pleasure end zone. It is a pleasure.
Yeah.
And so how is it that our brain, when we're thinking about playing, can go into, I have something to lose by engaging in play?
Yeah. I mean, so I'm not a therapist. And the reason I'm not a therapist is because I trained to be a therapist. I have a master's degree in counseling. I have done multiple clinical internships, including at the Kinsey Institute. And about halfway through that program, I realized I do not have the special magical thing that y'all have of sitting with couple after couple and individual after individual going, mm-hmm. What was that like for you? Like, I don't have it. I can't do it. I don't know how y'all do it.
I think you might make a better therapist than you think, because I'm kind of not that kind of typical psychotherapist. And
Well,
that's
one
part
of
of,
the reasons I love EFT is because it is so much permission for therapists, one, to be educators, which is something that was missing from my training, is the idea that you actually can teach your clients just like basic factual information about how things truly work in your brains and in relationships and in sexuality. And the other thing is you're allowed to laugh and recognize that, like, it is super fucking silly that we get stuck in these dynamics over and over and over again. We get stuck in the exact same dynamics over and over again. Like, it's funny.
Yeah, there's even moments. I have couples in vulnerability and they like bust an inside joke, and it's relevant to that. Everyone's got tears and I'm laughing alongside them. And it's not like a let's avoid
Yes.
this, it's awkward. It's we're actually deepening that vulnerability and connection
Yes.
with a playfulness.
And it was absolutely a part of my training that humor is inappropriate and your client is in a place of vulnerability and is much too likely to interpret your joke as making fun of them instead of like being lighthearted to engage connection with them.
So wait a second, Emily, you just blew my mind. I think what I hear you saying is that you were taught, as I'm realizing, I think I received the same message, like playfulness has no room in vulnerability. When in fact, I think what you've uncovered is that so much of playfulness is about vulnerability.
So much of it. Because it's about stakes. Like you were saying, it's about what's at stake. What do I have to lose? If you have something to lose in a relationship, there's a power imbalance, or you feel like you're having to put on a show for your partner and you're not being your true authentic self because you're worried that if you are your true authentic self, you could lose the relationship. In a fully healthy, functional relationship that's intended to like last till death do us part. You're not going to lose this relationship. There's nothing at stake as long as kindness and admiration and trust are at the foundation of it. You're never going to be making fun of your partner. All humor is a bid for connection, and you can respond to your partner's humor as that bid for connection. And it's a big if, because not all relationships and not all individuals bring to their relationships that trust and admiration. Does that make sense? So the context really matters. But one of the ways you can tell a couple is really strong in their connection is that they laugh together.
Yeah. I also think about this in terms of, I'm really big on therapists walking their talk, that what we share with our couples, our clients, isn't just something we administer to them. It's a value set that we apply ourselves. And again, I'm thinking about when I come together with my colleagues, I run workshops and such a lot, and I'm trying to get therapists to, again, shift gears out of serious mode because I know what it's doing to us, and helping them to experience a state of play because it literally feels completely different in your body. And it reminds me of that movie quote, "All work and no play makes Jack a dull boy," right?
Like, and we all know what happens in that movie.
Yes. I'm like, here I am in this group workshop trying to get therapists to play. And
they're like, I want to make sure nobody thinks that I'm like, nobody's going to take any offense. I'm not going to say anything wrong. Everyone's going to acknowledge that I deserve respect. Oh, man. And can we talk about imposter syndrome? The idea that we are all like putting on a show so that people will believe that we deserve to be in the room. And the origin of imposter syndrome is actually a social justice framework that we have been taught that who belongs in the room is white, cisgender, heterosexual, Christian men of between like 30 and 60. And anybody else doesn't deserve to be taken seriously. And we have to pretend like we are that. That's why we feel like imposters, is because we are trying to be that. And hopefully, I mean, it's 2025, so I'm not going to be too optimistic about things. But like in principle, we live in a world where more and more kinds of people belong in the room. Diversity belongs in the room. And we don't have to pretend that we're something that we're not in order to be welcome in a space.
So you're saying, basically, if we feel like there's something to lose by playing, it's like somehow playing is going to take away our sense of belonging. If my colleagues see me as right, and I offer like these silly icebreaker games. I was telling Emily before we started about a game that I have about accents. You say some phrases in a silly accent. You can see some of the therapists that have had some theater background, and ironically, more of our withdrawers and introverts are more daring and brave to do this. And then the ones that you normally see are extroverted are like, I don't want to look like an idiot, and they'll pass. like, the point is that we're all in it together. And I'm like, they're saying, but I'm going to look like an idiot. I think that's the point. So that
What
we
does
can
it
all
mean? Like, what are they, like, what is the consequence? Okay, so suppose you look like whatever you mean by idiot. What then? What, as any cognitive behavioral therapist would, so, and then what happens? You look like an
Yeah.
idiot, and then what happens?
Or true EFT therapists
Are
getting under that.
we going to kick you out? Like,
Yeah.
are you not allowed to be here? Is everyone going to shun you? And when they go home, tell stories about what an idiot you were, and no one's ever going to want to talk? Like, what happens next?
Never send you clients because you
Right.
are.
Because you failed to do a funny French accent.
Yes.
Come on.
Oh,
Like, let's challenge our cognitions, shall we?
Yeah. When in fact, and it's so paradoxical as we find in EFT, you lean into the emotion and we're getting the meaning embedded in those emotions, including fear, when our fight or flight goes off and says, if I do this thing is going to happen. It's
What's particularly about that, like, because it's a like verbal play, which is a very adult, very human kind of play, as opposed to rough and tumble physical play, which is both very childlike play and very animal play. Usually people really struggle with the rough and tumble kind of play where they have to do something physical with their bodies because they've been taught to like hold their bodies in a very controlled kind of way as an adult. And if you move your body in a wacky, silly way, you are a wacky, silly person who does not belong in the adult world. So for them not even to be able to play like just a silly language game, like that is a really high level of rigidity.
Yeah. Yeah. And they're saying it feels like somehow I'm not going to belong. So I'm not going to let my guard down. I'm not going to be. And then my nervous system stays in that serious mode.
Yes. And it's my guard that belongs, not me.
Right. And what you're also bringing up makes me think of like some gender norms. I'm thinking about even like gendered forms of play. How do women play? How do men play? And I think men are more socially trained that rough and tumble is acceptable.
Absolutely.
I don't see women do rough and tumble play unless they're like doing it for some like career on TV, like WWE or something.
Right.
No. And to me, that's still not even totally played, whatever. But
yeah, a lot of little girls are raised, literally, they're told, sit pretty, which is a command we teach dogs. Sit pretty.
Yeah. Or it's compartmentalized. Like the only place to tumble is actually in a tumbling class. Gymnastics.
In a tumbling class. You can take a ballet class.
Yeah. Or go on the field.
We can tell it's getting a little bit better because now girls are taken to play sports as kids, or they can do tumbling and gymnastics or karate or other martial arts when they are children. But when you get into adolescence, when you start having those secondary sex characteristics, that's over. Unless you're going to take it to a competitive level. If you're going to compete and excel, that is when you have permission to continue using your body in a way that feels good for your body.
And I'm realizing even how serious, like I'm even thinking as we're talking about how do my fellow women play? How do I play with other women? And I'm thinking like, we go shopping, we talk, and I feel like even that's super serious. Like we're supposed to have these deep, emotional, vulnerable conversations. And maybe some of our playfulness is having these conversations behind closed doors about sex and the body and things that we've been taught you're not supposed to say.
Or you gossip and make fun of other women.
Yes, which is terrible because no one wants to be made fun of. And it's like, but how do we actually play with each other?
Yeah.
I don't know.
Being an adult is bad news bears in a lot of ways. Being a human adult in America in the 21st century, like it is, like there's a reason why we have, I mean, it's been going up for a long time, but it is just this rapid escalation of isolation and loneliness, which we know from the research is the physical health equivalent of smoking almost a pack of cigarettes a day, feeling lonely, having less than like 2 close friends. people that you can talk to about your deepest concerns. And if there's no one that you can let your guard down with, like, of course you feel lonely because it's your armor bumping up against somebody else's armor. And like, that's not connection.
Right. Right.
So even if you have like a one night stand, you have like a hookup, like that's still your armor hitting
Not being
against somebody
vulnerable.
else's armor. That's
I'm
not
flying away.
vulnerability. You
Yeah.
literally never even know my name.
Yep. And I never have to see you again.
Yeah.
So I don't have to come in contact with the aftermath of what.
Yeah, whatever I share, I never need to deal with any consequences. There's nothing at stake because this relationship is not going to be anything. As opposed to in a relationship where you intend to have a sustained connection, like that's the risk, right? Is that like this disclosure, this authenticity is going to stay in this connection. Ugh.
Yeah. And I love that because it's also, I think about like the best sex has playfulness in it, even if you're
Absolutely.
not necessarily, you don't have to be putting on costumes or anything like you
Right.
could be, but it's a felt sense in your nervous system where there's a playfulness where you're exploring. Like, can you describe from all your research and understanding how playfulness lives in the nervous system?
So, for all my polyvagal people out there, play is a combined activated state of the ventral vagus and the sympathetic vagus. So it is a high energy state. It's an engaged state. We cannot sustain it permanently, but it is a positive, social, connected, easeful state. We feel at ease and not under threat. So even though our sympathetic vagus, so we usually think about sympathetic vagus as being like fight or flight. Essentially, this is where your increased heart rate in response to a perceived threat happens. That's your sympathetic vagus being activated. But play and your ventral vagus, we usually think about it as being like very peaceful, like sustained eye contact and feeling at ease in a soft, connected kind of way. But the ventral vagus can be activated at the same time as the energy of the sympathetic vagus, and that's where play happens. That's why even though you're sitting around a table playing Dungeons and Dragons, like your body is actively engaged, and when something amazing happens, you jump up from the table and like throw your arms in the air and shout because your sympathetic vagus is also activated, right? So
Yeah.
in a sexual situation, so we talked about rough and tumble play. We talked about word play. We talked about playing structured games. These are all ways that we can express play. One of my favorites is object play, which is easy to understand from the point of view of like babies. When they're taking a bath, this is my standard story is babies are like, what is this? And they're patting at the water. Like, what is going on with this? And they're like, oh, when I pat it, a splash happens. And then they're like, they switch from what is this to what can I make this do? And they learn that something they can make this do is splash their adult caregiver. And they start splashing you while you're trying to give them a bath. And it's hilarious for them. They love it. They giggle, they laugh. And don't we love it when we hear our babies laugh, right? That's object play. What can I make this do? And it's curious. There's nothing at stake. It's an exploration of an object. What can I make this do? What if our partner's genitals were approached with that point of view of like, ooh, what's this? What can I make this do? There's no performance demand. There's no expectation. There's just what feels good to me and what feels good to this person. What
Which
can I make?
Curiosity too.
Yeah, curiosity is so important in a play space because it's not about like, can I live up to somebody else's standards of what I am supposed to be doing here or what's supposed to happen. We both just want to, again, there's nothing at stake. You got nothing to lose. Like this relationship isn't going anywhere if this particular interaction with your genitals doesn't turn out according to what the rule book says. Guess what? There's no rule book. I have only two things that I require from a sexual experience among any people on earth. One, everybody involved has to be glad to be there and free to leave with no unwanted consequences, which is how it should be with any game. Like, if you're in the middle of a game and somebody has a family emergency and needs to leave, you're like, oh, but there's no unwanted consequences. People should be able to leave a sexual experience in the same way. And then also no unwanted pain, which is also even in rough and tumble play. Like when you're training a puppy not to use their mouth with humans, when they use their mouth, you make a big noise. And they know that was too much. I used my mouth too hard. And they learn not to do that because part of play is no unwanted pain. Does that make sense?
Yes.
So if you can approach your partner's body as like, this is a playground. My body is a playground. This time that we're spending together is not about following somebody's rules and meeting somebody else's standards of who we're supposed to be and how we're supposed to be doing this. It's just, what do we like? What's fun? There's a mystery novelist from the 1930s named Dorothy Sayers, who had her detective say that the only sin passion can commit is to be joyless. It must lie down with laughter or make its bed in hell. There can be no middle way.
Yes.
If you can giggle at the same time that you have an orgasm, you are doing it right. That's like peak human experience.
Yeah. And how many of us move through life, and especially as career professionals where life is serious, move through life without joy, whether we're experiencing it in sex or just even outside of sex, right? Because sex is through the playhouse, right?
Right.
And how many of us just never even get into the playhouse at all?
Right, because we're so concerned about, in every domain of our lives, meeting the standards, checking the boxes. Like you started this off talking about how like you are doing all the things right. You like run a practice and you have a nonprofit, and a thing happened for me. So I finished my PhD. The day I defended my dissertation, my body, my physiology changed. I felt a shift of like, oh, I did it and I can relax to a large degree now. I felt like I had something to prove. I wrote the dissertation, and unlike a lot of people who feel like they have something to prove, I was like, I proved it. I did it. And I became a nicer person literally that day.
Yes. Oh my God.
The trouble comes when people are like, there's literally nothing I can do that will prove whatever it is I feel like I have to prove.
And you know what I realized too, as you're saying this, Emily, is like the more I've taken on, it's like the more things I'm responsible for. When people talk about playfulness to me, sometimes it feels so misattuned because I'm like, it's easy to play when you have nothing you're responsible for.
Right.
And I'm like, maybe that says something. It's not necessarily wrong to have ambitions and goals and such, but if it hijacks my whole life and I'm not able to experience, like, what's even the point of doing all the things if you never get to experience joy?
The joy of it.
Isn't that
raising children? Oh my gosh.
Yeah. And I know it's incredible because I hear people talk about all day long how they want to have kids so much, and then they have kids and all they do is complain about it. And I don't think they realize how that sounds to people who don't have kids, who are
and there's a lot of like agonizing things about raising children. Like let's be real. Like and also kind of the good part about having kids is the kids are hilarious.
I know. We can learn a lot about playfulness from kids. And, you know, as you're saying all this, I'm thinking about the role of responsibility and playfulness and how we might have a hard time asking for help. Or sometimes, I mean, for real, like I have a colleague where I call her and say, look, I have all these responsibilities and I just need permission to like put those aside for the night and not feel guilty so that I can watch a movie without guilt.
Yes.
Find some relaxation and freedom.
Oh my gosh. Yes. So this is the moment when I need to mention Trisha Hersey's work. She is the Nap Bishop. You will find her on all the social medias at the Nap Bishop. Her first book is Rest is Resistance. The second book, which is a work of art. It is a beautiful, beautiful book, is just called We Will Rest. And for a lot of people, a conversation about play is like advanced 400 level living a human life, because they can't even sit down and close their eyes and be still for 15 minutes without feeling like they need to jump up and get something done.
Mm-hmm.
And there's a lot of reasons for that. And Trisha Hersey goes into all of them and addresses all of the resistance. But like, if you don't even feel like you have permission to get adequate rest in your life,
Mm-hmm.
how are you going to feel like you have permission to play?
Mm. Yes. And I do feel like a lot of it's driven. I notice a lot of cultural differences especially in American culture, where it's like you got to squeeze every last minute out of every last second of every day, or you're a loser, you're left behind, you're not meeting your life's potential.
Yeah.
We're so exhausted. But, in Europe, they take naps in the middle of the day. They give businesses permission to close between lunch and
Close
dinner. Yeah, close. Like, it's okay
for a month at a time.
Yeah, like, money is important, yes, but it's not the most important thing. Rest is important, and we're going to prioritize that. And it's okay that we sacrifice a little extra money we could earn by staying open so that everyone can be sane and rest.
Imagine an organization acknowledging that the people who work there are human beings living in mammalian bodies.
Right?
Like, and we're not machines.
Yeah.
And
but we're trying to treat ourselves as if we are
machines who do
human.
not require sleep, who do not require, as we do, who do not require play and connection and a sense of community and organization and belonging.
Here's a funny irony, is that so many humans, especially humans that I treat, spend so much of their life trying to be like robots, machines that don't feel. And yet, what do you see in every movie about robots is that there's some fluke in the coding where they start to feel. We cannot imagine robots that can't feel. So robots want to feel and humans want to be robots. Can we just enjoy the grass we're standing on and not want some water it and not want someone else's? It's just so funny. And okay.
Can we just water our grass?
Yes.
Let's make that a thing.
Yes. And I love this. So resting, and often I've shared that with my clients, resting is doing something, recharging your batteries so that you have more energy. And resting doesn't always necessarily mean having a nap. It
doesn't have to be sleep.
Transitioning your nervous system from that state of stress, which I feel like playfulness is, because if you really tune in to emotion in your somatic body, because we know it's there anyway, whether you want to embrace it or not, more good comes from embracing it, because then you know how to do better with it. But you will feel a huge shift when you get out of serious mode into play. It is a visceral experience.
And people struggle with transitions. Neurodivergent people in particular struggle with intentional transitions from one thing to another. We need rituals, and we need an intention and a desire to get to a different state for some reason. As an autistic person, I can write for many, many, many hours at a time and literally never get up from my desk and just be locked in to work. That's just because I can does not mean I should. There are many writers who are like, well, that must be nice for you. It's actually really bad for me physiologically, because I live in the same mammalian monkey body that you do, that has the same mammalian monkey needs as your body. But my brain has this trick where it just gets stuck in this groove. And it is hard work for me to get out of this groove and shift into a different one. And I've had to develop the skill of transitioning out of that state into, you are a human being with relationships that you would like to last longer than this work project.
And that's so much of my work with my ADHD clients, being an ADHD therapist. and helping them tune into those emotions, knowing like, because I feel like for ADHDers, when our gaslight comes on saying empty tank, there is a steep decline from when that gaslight goes on to the end of the tank versus.
Yeah. It's like the light goes on when you've got 5 miles left.
Yes. Yes. And so learning how to like tune in before you get to the gaslight
Mhm.
and knowing what happens for you when you get to the gaslight, what kinds of things can prevent it. Because a lot of us, like, that gaslight is going on and we know we're at the edge, but we'll keep pushing. And then it's like we fall off that cliff, our circuits fry, and we become very like agitated and cranky. And it's like, get away from me. Like,
Yeah.
you know.
Uh-huh.
And it's,
I do know. Yeah.
yes, yes. And I love it too because, you know, I love that you talk about being autistic as well, because I imagine a lot of folks out there, I hate the way that they say, oh, because you have this tism and that, you know, ADHD, this means you can't do these things. I'm sorry, I call bullshit. We can. We have different hurdles to overcome to get there, and we're rolling with some different factors, but
Yeah.
we got it.
And like, look at us.
Mhm.
Because our brains are different, we live in the same world as everybody else, but we have had to work out strategies for making this world workable for our brains. So we're the ones who have the insight into, oh, here are the places of friction that brains run into. And like, if we can work out a way to make it work, we're the ones who can help other people, and other people are going to have an easier time being like, oh, here's the skill I learned from this person who, like, this is a hard won insight that I can just immediately implement fluidly into my life. And like, you're welcome.
Yeah.
And I love that that's a contribution I can make, but like, my brain is difficult to live in. And also because I have learned how to live in this brain, I have a lot that I can teach other people about how to live in their brains.
Yeah. And you still have a mammalian body that does feel, right?
Right.
And I love that. And
just because I can write for 12 hours at a time doesn't mean I can go 12 hours without peeing. I really should not do that. Right.
Yeah.
Or food or water.
Yes, yes. And I love, you know, what you said is just because I can doesn't mean I should. And that's a lot of when I'm trying to help therapists with self-care. It's
when I worked with college students, they have literally raised their hand and been like, I disagree.
Right. Yeah.
Yo, grind culture is real. Like we are. That is so toxic.
And you got to work in your window of tolerance. And I think playfulness, when you can make that shift, can help extend and expand your window of tolerance. Maybe put a little bit of gas back in the tank.
Yeah.
Stop the depleting. You know, I see a lot of therapists, you know, and meditation can be wonderful, and it certainly has its place.
Yes.
What I find with a lot, the way it can be presented is almost like meditation has become actually a new way to check out. And
100%.
To check in. And I'm like, you ever take a straw and you put it into a glass of water and you put your thumb on the top and pull out a little bit of water? Like, you meditate for 10 minutes and then go back to working. You've changed nothing and you're still working out of your window of tolerance. It's like taking that full cup of water, saying, I'm going to empty it a little bit by putting a straw and just taking out as much as will fit in a straw out of that cup. Yeah. Look, your cup's still full, you know? So it's that.
And it's another place to feel that you are a success or a failure because of like how you do at meditation or at yoga or any other kind of mindfulness practice where it's a way to tell whether you're succeeding or failing. Yo, there's nothing at stake. There's nothing at stake. There's nothing at stake.
Thank you for saying that, because everyone says, close your eyes and meditate. Okay, my neurodiverse brain says, you know, it's like a toy store up in here. I close my eyes. You just lock me in with all the squeaky toys. Like, I have to focus on something outside of my body to draw me out of the toy store.
Before I knew I was autistic, I wrote a foreword to Lori Brado's very wonderful book, Better Sex Through Mindfulness. Lori Brado's research focuses on women survivors of a variety of things and their sexual functioning, including gynecological cancers. And it turns out mindfulness is an incredibly powerful skill for helping women who are survivors of cancer, survivors of trauma, to regain access to pleasure. But in my forward, I talked about my own mindfulness practice, my own meditative practice, that it was never for me about like getting quiet and still in my brain. It was like 64 fire hoses all spraying in different directions. And like my job was to stand back and watch the fire hoses. Like it was like the fire hoses were not going to turn off. And like now I know why. My brain is not the same as the other girls.
Yes.
But
yes.
Like that's still my mindfulness practice. Like the fact that I can get that observational distance, which is actually part of the emotional floor plan, is being able to zoom out and watch your emotions and know that you are not your emotions, which is part of how we recognize that like there's nothing at stake and emotion is happening in your body. And like, that's okay.
Yeah. And emotions, it's just information that informs you about the quality and context of your reality and your in it, and I love that you said that. And so really it's a lot about figuring out how your body works, how your brain works, and being able to roll with it.
Yeah.
If you got to do playfulness and mindfulness in a way that's not in the box, like isn't playfulness all about getting out of the box, like destroying the box, erasing,
literally,
redrawing
literally. When you were talking about like the glass is still full and people are like doing like one straw full at a time of emptying, and I'm like, what people actually need to do is pick that glass of water up and dump it on their head.
Yes.
Just be like, bloop, I'm wet now.
Yes. Yes. And I love, you're talking about how we can shift out of like red brain state where our brain's in, the activated, nervous system, fight or flight. And like not all stress hormones are related to something bad. Cortisol, adrenaline are involved in excitement. And
it's just activation. Yeah.
Yes, yes. And even cortisol is involved in waking you up in the morning, right? You're not filing your tax. I mean, maybe some people are doing it in their sleep, but you're not waking up. So that's your body kicks on to help you wake up. So, but also when your brain can get out of that state, and it also reminds me of how learning occurs, right? Is in the green brain state, curiosity.
Yes.
You talked about it all brings me back to, curiosity, which is a part of playfulness, the seeking with nothing to lose, because there is a difference between I have to learn this information because if
else
there's something to lose, right? And you don't end up retaining that information very well versus when my system is open, I'm in green, all systems go, right? No danger, no threat, nothing to lose. I can seek information with curiosity, and it is a felt experience in your body. And because a lot of clients ask me like, well, how do I do curiosity? And I'm like, okay, we're going to help you feel the feels, because the feeling of curiosity is also very visceral. And when you're in curiosity, the things you want to seek and learn and even questions you want to ask just kind of make themselves known. But it's, you have to be in that place like a vault. You can only
you have to be safe enough, like not under immediate threat. There's a very silly experiment that I'm going to shortcut through by just saying, like, imagine you have to go through a maze. It's literally a piece of paper with a maze drawn on it. And for some people, as you do the maze, you're pretending to be, you're like a little mouse drawing going through the maze. And for some people, there's an owl, an illustration, just an illustration, like a line drawing of an owl. And you have to get away from the owl. And for some people, you're a little mouse and there's a line drawing illustration of a piece of cheese. And the people who are moving toward the cheese do much better than the people who are just trying to get away from the owl. And it makes sense because if you get away from the owl, all you need to do is get away from the owl. And as long as you're not at the owl, you're good, but you're in sort of like this chaos state and struggling to get through the maze. Whereas if you're going towards something, if you have a goal, like, ooh, I want to get to all of that. Ooh, yes. When you're in that state, that curious exploration, there's something I want to know. That's when we do much better at learning and growing.
Emily, I'm going to like dub you an honorary EFT therapist because that's brilliant. It's actually,
there's a reason that I love EFT.
Yes. And it's like, I describe this when I'm trying to help therapists learn the difference between the beginning of EFT versus like our second stage. The beginning is like helping couples and individual families, whoever, navigate that sense of danger, what we can do together as a team to fight that sense of danger. But our later stage is about bonding, right? Which isn't just, okay, now that we don't have to move away from danger, isn't the same thing as bonding, right? So,
and the moral of the story of Come Together even is that the couples who sustain a strong sexual connection over the long term are the couples who collaborate to co-create a context that makes it easy for their brains to get into a play state, a seeking curious exploration state, a pleasure favorable state. They're working together like it's a hobby that they share, because it is a hobby that they share. It is not like a problem they're trying to solve. I mean, sometimes there are problems. Sometimes it's a chore, but like most of the time, like you do it because you really enjoy it.
Yes.
And like, I want to create a world where all of us only ever have sex that we like. That doesn't feel like too heavy a lift, right? Like we can get there.
I say the same thing about food. When people are like, oh, you have to acquire a taste for it. I'm like, but if I don't like the taste of it, why would I keep putting it back in my mouth? Like, acquire a taste for that. It's not pleasurable,
Right.
And I love co-creating because also our sense of danger is not individually constructed. It's also co-constructed. So the best
if it's actually true that your partner is a threat, that is a much bigger problem.
Or if you have,
hopefully they're a conspirator with you.
Yeah. And your partner doesn't have to be the original threat, right? A lot of clients that come to me, other humans have been dangerous. And so it's like, once bitten, twice shy.
Yeah.
Now it's like we tend to look at our partners as a source of danger. And so a lot of what we're doing is sort of reconstructing that into safety, where we can have those pleasure favorable, where we can see our partner is friend, not foe, right?
Right. And when it comes to sexuality, not only are many, many of us survivors of actual traumatic experiences, even more of us have been shamed for our sexuality. And so we spend a lot, even of our long-term relationships, just trying not to do anything that we feel ashamed of in front of our partner. So like the inside of our own heads is where the threat lives. And we have to confront that stuff. And be like, oh, wait, no, I got lied to my whole life.
That
there are rules I'm supposed to be following, and like there are no rules.
Well, and also when other people have been a source of danger, especially around sexual trauma, it's like then that trauma hijacks our ability to move towards sex, and it's like sex now becomes dangerous.
A sense that it's a threat and dangerous, yes.
Yeah. So we don't even allow ourselves to rebuild our relationship with sex and sexuality within our own body because it's just labeled in the danger box. Get away, get away, get away.
Yeah.
So, Emily, if we were to take quickly just sort of that emotional floor plan from your book, Come Together, you guys got to read this, it's brilliant. How would people sort of use that principle to construct like their playhouse?
So what I recommend is that people like just start with, we've mentioned the like pleasure adverse spaces, which are fear, rage, and panic grief. We've talked about all those, but we haven't really focused on those because that's more difficult. Like just focus on the pleasure, care, play, seeking, which is curiosity and exploration, and lust. the goal is to get, if you want to like increase your access to the lust space in your brain and your relationship, think about where were, like, when it was easy for you to get to the lust space, where were you right before you got to the lust space? I mean, not like geographically, where were you, but like in your emotions, were you feeling really cared for and held and connected and loved? Were you feeling really like curious and intellectually exploring, or like, going to an art museum? Or were you writing or doing art, creative things? Or were you laughing together?
Mm-hmm.
What was happening right before? And that will tell you what the room next door is to the room where it happens.
Mm-hmm.
Pardon the Hamilton reference.
The places you have to go through to get to those rooms.
To get there. Because if you try to force yourself into the lust space directly, it ain't going to happen. It's literally called the ironic process, where the harder you try to get somewhere, the more difficult it's going to be for you to get into that emotional state. You have to allow your brain to transition into.
That's the same principle around like performance anxiety in the bedroom.
Yes.
Which is the enemy.
Yeah, erectile dysfunction, orgasm difficulties, so many desire problems. It's basically the sexual yips.
Yes. And, as you're saying, I was wondering, like, what about people who maybe have never been allowed, or they've had to banish their pleasure spaces, the lust space, even the playfulness space, like depending on, children were seen and not heard, or sex was like vulgar or distasteful or shameful, like maybe some of these places have gotten banished to the attic or the basement.
Yes.
So I found it really.
If you're Gen X and you got parentified real early in life, yep.
Yes. Yeah. Some, just even the concept of the emotional floor plan, guys, read her book and get on this, because it's so eye-opening. Just mapping that out to figure out where are these spaces in your life in relationship to each other, and what do you have to get through or to, even if you want to, like, even if I've never been there, but I want to get there, I want to make it easier, what rooms are standing in the way, right? And it's so
just like figure out what room you're in. Like when I was struggling with my own sex life, I was just like bouncing against the walls of the fear space. I was so anxious and I couldn't find a way out. And it was recognizing where I was and figuring out what helped me to get out of that space. And okay, cool, now I'm out of that space, but where am I now? And what do I need to get to a space where it's going to be easy to get to the play space? Even just learning to recognize in the moment what emotional space am I in right now is so valuable. In any EFT client, like having that vocabulary of like, this is the space I'm in, this is what it feels like, and here's a list of 20 things that can potentially get me out of this space. Here's what's available to me right now.
Yes. And if you were kind of to sum this up with can you maybe give some statements about why getting into pleasure favorable playfulness state is essential for us?
Oh boy. I mean, the foundation of it is that when you are in these pleasure favorable spaces, these are ventral spaces in polyvagal terms, and it is only in this activation of safety, connection, ease, that all of your physiological systems are fully online, and you can heal from diseases, you can recover from physical activity, you can sleep restfully. Like, the foundation of our health is having access to a sense of pleasure, ease, joy, and play. Literally the foundation of our health.
Yes. Thank you for saying that. And it is essential. If you're a career person watching this, a therapist, or just a regular person, if you notice, even at night, if you got trouble going to sleep and you're noticing, I didn't have any time to shift between work mode and going to sleep, like, what can I do to build in play, right? Because if I don't allow my nervous system to make that transition, because also going into sleep requires us to put our guard down. We're in a vulnerable space. We need to know we're not going to be attacked, like a sleeping bear. I know there's not going to someone come into the cave and like kill me in the middle of winter, right? We got to put or a hippo, because you love hippos, right?
I do.
We have to be able to put our guard down and allow our body to fully power down, power off. So I found that being able to enter some form of playfulness, however that might look, between work and sleep is like essential for me to know that I'm going to get a good night's sleep. Otherwise, my body stays in work mode and it's like in this heightened state of stress because,
And just because people tend, like, at a point like this where we're like, what are the tips though? Like, what do I actually do? People tend to list behaviors. And like, there's all kinds of things you can do to wind down. Like, skincare is a thing people often do in their transition from awake to asleep. But if your skincare feels like, oh, I'm just trying to fix these problems, that's not restful. If your skincare is, I am quenching my body, and what a joy and a delight it is, what a gift, what a privilege, what an honor to live in a body, and what a freaking fracking miracle my body is. Like, that feels warm and connected and affectionate toward who you are. And that is a peaceful transition from awake to asleep. It's not what you do, it is the state you are in while you're doing it.
Which is composed of how you feel. So
yeah, bring that playful energy and sense to whatever it is that you, if it's putting the dishes in the dishwasher and hitting the button, can you bring a sense of play and gratitude and ease and joy to this little chore that like is just a necessary part of owning a place where you live?
Yeah, if you're not really emotionally connected, because playfulness, rest, relaxation, curiosity, these are emotional experiences. Yes, there are behavioral expressions of them, but just because you do the behavior doesn't mean you're going to feel the feels that go along with it. And so you won't get the benefit of performing the thing if you're not emotionally connected to it. So y'all may need to do some work on connecting to your emotions. And again, they're not to be feared. They're information and they're there whether you want to accept them or not. So
100%.
Might as well lean in and get to know the information because it is very useful and will help you. And often, what I help my clients with is, again, it's that vault. When you can only access the door from within side. So you got to go into, it's like the Chamber of Secrets, corny Harry Potter metaphor, but go into the Chamber of Secrets and the answers will be found. The thing, the behavior, the way you want to express it will become known to you when you allow yourself to shift into that space. And often what I want to do in this moment or that moment may be different, especially given context or relationship or whatever, give us room for diversity. It doesn't have to always, you can use your nightly routine to check out and numb out. And the same concept with my couples. Moving away from the danger isn't the same thing as experiencing joy and pleasure. Numbing out of stress is not the same thing as shifting your nervous system to a state of play.
Yes.
So,
yes,
we're all going to work on playfulness.
Yeah.
It's good for our health.
Hopefully people are motivated, right? Like, it's so good for you.
Yes.
It feels good. And like, just because our culture has like shamed you for like being an adult who plays, like, forget the culture. Doesn't matter. Break the rules. Break the rules, and you'll be happier and healthier and have a more joyful, more sexual connection if that's what's right for you in your relationship.
Yes. So here's what I'm taking away from Emily's talk today. And again, read her book, Come Together, and her book on burnout. They are fantastic. So when you're walking away from this podcast, I want you guys to think about playfulness and your own blocks to playfulness. When you think about playfulness as a pleasure favorable space, do you even recognize play as a pleasure favorable space? If not, what comes up for you there? Lean in, be curious, get to know. Also, if you think about engaging in play and your alarm bells go up, your guard, like, no, I'm so inhibited, I can't let it down, can't look like an idiot. What is it that your nervous system is telling you you have to lose by playing? And also, here's another EFT Jedi trick. What do you lose by not engaging in it? Yes. So, and think about how you'd like to play and how that might look from within the Chamber of Secrets. So, thank you again, Emily, so much for talking to us about play. And just real quick, before we close out, do you have a favorite way of play that you like to engage in?
Oh, yes. So I have it here at my desk. I mentioned Dungeons and Dragons. I'm not a D&D player myself, but there are all kinds of role-playing games. So the one my husband and I have been playing is Wander Home. And you literally, like, you pick a character that you are, and you pick a starting place, and you are just each a character, and you together invent a story of what you, as these characters, like, what adventure are your characters going to have? You get to make up the whole thing. It's all imagination and creativity, and my husband is so good at it. And it just, like, I get to admire how good he is. I get to play with my own storytelling, y'all, is such an important source of play. That's what we've been playing lately.
That's awesome. I love it. And if you get a chance to listen to Emily do a talk, she shares some other forms of play that are just awesome and hilarious. And, it's almost like listening to Emily could be my form of play because you're just so dang cool. And I just feel happy on the inside. I smile with my belly.
It's one of my very favorite things to talk about. I really appreciate the opportunity to just, like, sit and talk about, like, how can we spend more time accessing play and why is play so freaking important?
I know. And my ADHD brain loves creativity, likes to break boxes. I'm like, you know what? I want to freaking finger paint. I want to go in a ball pit.
Totally.
Like, yes, I want to go. I don't worry about the germs.
And my autistic brain is like, I don't want my fingers in paint. Yuck.
Yep. Yep. But, like, I just want to do silly things.
People vary. Do the thing that's right for you.
It's just permission to let go and be silly and do the things. Sometimes I think that's the fun part, is doing things that you think you're not supposed to do as an adult, but not in, like, harmful ways, like finger painting or playing in ball pits.
Yes.
The place where adults aren't allowed, that are really innocent, like, bring back the innocence to the play.
Yeah.
Let your hair down. Permission to be silly. So go out and find your silliness, y'all. And buy Emily's book, Come Together. It is amazing. And it's now on audio version. And we're going to put the link for that in the description for this book. And if folks want to find you, follow you, where do they, if they want to attend something that you're doing or an event you're speaking at, how do they find you?
EmilyNagoski.com is the website. When I have publicly most of the events that I'm doing lately have been, like, professional trainings that are not open to the public. But when there's public things, like at bookstores and stuff, they'll be listed on my website. And I'm on Instagram at @enagoski.
Perfect. Y'all look her up, find her. She's amazing. Also read her book, Come Together. It's going to blow your mind. She's got lots of YouTube videos, podcasts. Freaking brilliant, amazing mind. Thank you for coming today and talking to us about playfulness. And make sure that you guys follow her on Instagram. And again, look for the links to all of her stuff in the description for my video. Maybe come join me on my We Heart Therapy retreats where we get to play. Therapists.
Sounds so fun.
If you are a therapist, come on down. You can find on my website, wehearttherapy.com. Hopefully you'll come and play with me. As a therapist, earn your CEs while you're having some playful time. And if you haven't hit subscribe, make sure that you click that button at the bottom because more videos are on the way.
Don't forget to buy my book, Using Relentless Empathy in the Therapeutic Relationship, Connecting with Challenging and Resistant Clients for Helping Professionals. Available on Amazon or on my website, www.drbugatti.com.